Assalamualaikum and hi, I am Malatina Shakiri binti Isa. This is Nur Azli Hani Anisha binti Muhammad Azli, and this is Nur Ismahani Izzati binti Asli. So we are going to present Antero-Posterior Pelvis Projection. So let's go!
Let us study the anatomy of pelvis. Pelvis is a part of the trunk, inferior posterior to abdomen, in the transition area between the trunk and the lower limb. So, let's check out on how to do an epipelvis projection. For patient position, the patient should be in supine position and the lower limbs of the patient are internally rotated about 15 to 35 degrees from the hip to demonstrate an epi view of the proximal femur. For beam collimation, it should be collimate laterally to the skin margin, superior to above the iliac crest, and inferior to the proximal third of the femur. For the central ray, it must be directed midpoint between the anterior superior iliac spine and the pubic symphysis.
For the part positioning, the radiographer should center the mid-sagittal plane of the body to the midline of the grid. For example, this is the patient and this is the mid-sagittal plane of the body. And imagine this as a grid. So this is the midline of the grid. So the midline of the grid must center to the mid-sagittal plane of the body. Patient. And how to make sure that the patient is in a true AP position? So you need to use your both hand and place it at the antero-superior iliac spine. And if the distance from the ASIS to the tabletop is equal, this is shown that the patient is in a true AP position.
So this is antero-superior iliac spine, or in another word, ASIS. This is what I mean by the distance of ASIS to the tabletop. If you want to make sure that the patient is in a true AP position, you need to make sure that the ASIS to the tabletop of the right side of the body patient and the left side of the body patient is equal. But how? By using your hand by palpating it.
For the exposure factor, the optimal exposure is 70 to 80 kVp and 20 to 30 MAS. The value of these two is depends to the size of patient's body. And for the technical factor, which is SID, or in another word, source image distance, which is the distance from X-ray tube to the image receptor, is 100 cm, and the cassette size we use for this projection, which is antero-posterior pelvis projection, is 35 cm times to the 43 cm, and the orientation of the cassette is crosswise.
So imagine this two cassette is a 35 times 43 cm cassette. So you need to place this cassette under a table bucket like this. This is a crosswise position. If you put the cassette like this is wrong because this is a lengthwise.
Okay, I will talk about radiographic criteria that will be divided into 7, which is called as a placement. The first one is position, A for anatomy, C for collimation, E for exposure, M for marker, and another A for aesthetic value, and the last one is name.
Okay, the first one I will talk about positioning. The position for this projection is correct. This is because no rotation can be seen from the radiograph. Okay, as you can see from this radiograph, the ilium, both ilium from the right and left has the same size, and same goes to the aperture foramen. It also has the same size. The femur also has the same size. So this is the evidence where there's no rotation can be seen from this radiograph. So the position for this projection is correct. Okay, the next one is I will talk about anatomy demonstrated. The epipelvis projection should be demonstrated. Entire pelvis along with a proximal femora, and then lesser trochanter on the middle of border of the femora should be demonstrated in this radiograph.
And for the collimation should be done to all four border of the film, and should include, for the superior border, it should be include iliac crest. For the lateral, should be include skin margin, and for the inferior, should be include proximal third of the femur. Okay, for the next one is exposure factor. The KVP is used adequate for penetration and radiographic contrast. the MA used is adequate for detail and density. As you can see the image here, we can see that optimal density and contrast is being used. So you can see the image can be seen clearly. The next one is marker. For this image radiograph, there is no evidence of an anatomical marker shown in this radiograph.
Okay, next about aesthetic value. The alignment between film and patient is correct as the distance between four border of films is equal to the centering. As you can see from this image, the border from the upper and lower has same distance, which is 6.5 cm, and from the left and right also has the same distance, which is 6.5. So this is shown that alignment between film and patient is correct.
The last one is there is no evidence of patient identity because of a confidential issue. And yes, the last one, diagnostic acceptability. This radiograph is acceptable because as it's not under-penetrate and not underexposed. So it will qualify as a good radiograph we can use.
That's all from us for this presentation. Thank you!